Graft means the most important lesson in plastic surgery. Graft is a sort of tissue. The tissue can be a part of the skin or a bone. In their transplantation, a tissue means a part which carries hair cells and follicles. It can cause a lot of problem by a lot of patients because a graft has one cell or two cells or 3-4 cells. This can change. It is all up to the hair capacity of the nape. The most important thing in receiving hair is the ratio of a graft. For example, when we receive 3,000 follicles from a patient, it contains 10,000 petr. It means approximately 300 grafts. And these 300 grafts, 2 petr, has mono follicles. So, about 600 follicles are mono. If you can't receive good hair cells, about 1200 grafts contain monofollicle. This directly changes the result. Graft amount is very important to show the hair more healthy and brilliant at the end. The punch is one of the most important thing in hair transplantation. This is very complicated, but according to our clinical experiences, we use 0.7 or 0.8 because they are very suitable for the operation. We use 0.7 mm punch to thin hair. 0.8 mm one is for the thick hair, especially for the curlies. Some patients tell that other clinics use 0.6 mm punches. It doesn't mean that if a punch is thin, the receiving operation will be fine. Because, as we know, not only the amount of hair follicle, but also its quality is important. You receive 3,000 grafts with 0.6 mm punch, but all of the 3,000 hair monocells inside. So it means that this operation will not be so successful. It is a must to analyze the capacity of the nape. As you guessed, 100% or 90% or 95% of the patient has monofollicles. That is why we had better not to think the operation will be perfect. This is a very important point. We doesn't think that it means that how thin the punch is, the result will be good, or the amount of the grafts or the speed of getting well will be better. How we specify the amount of graft number is the target. Doctor, how many grafts do I need? Is the basic question. Because when we decide this, the patient's results will be done for. There are two basic points which I care about as a plastic surgeon. First of all, the empty space of the patient's. The second one is the capacity of hair in the nape. Of course, in addition to this, we should care about the patient's expectation. After considering the two basic points, then we add the patient's expectation and then I decide to do the operation or not. The most basic points are the empty area and the capacity of the hair in the nape, because it can show differences in narrow or wide empty spaces. If a patient has an empty area on his or her front, 3,000 to 3,500 grafts are enough. Less grafts are applied on the patients who have a narrow emptiness. On young people, I prefer to add small amount of hair and I apply only one seance and wait. If the follicles don't answer to therapy, then I prefer the second seance. Because as we know, hair loss continues until age 40, and even if 45 years old, a man who have hair loss I saw. According to my clinical experiences, if a hair will be lost, then it will be lost. Absolutely. If we want to load beautiful brush and our hair clearly, we have to calculate the hair on the nape and leave enough to reserve. It is a must in hair transplantation if a patient has a very wide empty space but has a big amount of hair capacity on the nape. We do 2 seances on 2 days and add 5,500 to 6,000 grafts. We consider the results accordingly to this. We plant 3,500 to 4,000 grafts on patients who have wide open areas and don't have a wide hair capacity on the nape. We plant front and the top, and 6 months later to the top and sides we through soft passings.